I think the average time saved per case is around 6 hours. I think a conventional tooth preparation, full arch can be 2 to 3 hours. Then you've probably got an hour review in the middle with the provisionals. What you also notice is because the patient hasn't been in provisionals today, the soft tissues are already really healthy and good. Yeah. So being able to bond confidently, even with just an Optigate on, and still be confident in the level of isolation that we have, all these little differences have a huge compounding effect at the end to how confident we are with this workflow.
If we can make changes even on the mock-up chair side, scan it, guide that to the CAD/CAM technicians. Certainly in my hands, and many of the dentists that I speak to, there's not a lot of refinements that are necessary to be done because we've taken our time to do it at each stage properly.
And that's a very important point. I think with digital and CAD, yes, it's brilliant and can get most of the job done. So you do the chair side mock-up or the chair side provisional and pretty much accurate, but we're not losing our artistic flair and our own touch. So quite often you can have a couple of tweaks at mock-up stage and you want to add them in. It brings customization and control and better communication between the patients and the dentist. Do a chair side on the mock-up, scan, and then kindly ask the lab to copy the changes you've made into the final restoration.
Yeah, it makes sense. Saves a lot of time.
First of all, relax, don't panic. So we would just plan to finish the cementation process. The veneer, which is debonded, that then needs a cleanup, ideally a sandblast of the surface to get it clean again. Go back to the etching and bonding process, make sure the tooth is clean and there's no resin or anything on the tooth. So usually I would white stone the tooth or disc the tooth. And then I would just go back to my conventional cementation process and stick that veneer on its own individually at the end. For a technique like FirstFit, a workflow like FirstFit, we would recommend being certified first in the course. And we believe that is the recommendation from FirstFit themselves. So my recommendation is join a course, you get the hand-on experience with the bear, with the handpiece, with the guides, you understand the workflow end to end, and then you can confidently take that into your clinics.
So thank you again for joining us. And hopefully we'll see you guys at some point at some lecture or even here in the future.